Hi, I'm Dr. Anamika Joshi. I'm an eye surgeon and I'm practicing in Hyderabad. So today I'll be talking about conjunctivitis or pink flu or eye flu as we call it. So these days in this rainy season, we are seeing a lot of cases of conjunctivitis. From my staff members to my house help to everybody, I'm seeing a lot of cases. So it is very important to understand this problem in slight detail. So what is conjunctivitis? It is basically an infection of the outer layer of the eye, which we call as conjunctiva. A virus or a bacteria both can infect this outer layer of the eye called conjunctiva and can produce the symptoms of conjunctivitis. It can also be due to allergy in which itself it becomes reactive. So what are the symptoms of conjunctivitis? Initially, to begin with, you will feel slight irritation in your eye or feeling like something is there in the eye. Then slowly you will develop little redness of the eye, then watering of the eye, followed by swelling especially of the upper eyelid. Your eye will appear more swelled up. In severe cases or in cases where there is bacterial infection, you will get little bit discharge also here, especially collecting early in the morning where here in the corner of the eye will get filled with white discharge. So all these symptoms are suggestive of conjunctivitis. Rarely when the cornea is involved or less commonly, vision also can get blurred in some cases. This can happen in one eye or it can start with one eye and then affect your other eye. So it's very important, if you get these symptoms, you need to avoid over-the-counter medications and you need to visit an eye surgeon. Based on which stage you are in, whether it is mild or it is severe, whether it is involving your cornea or not, based on that we give medications, and the medications are not same for all the patients. So that's why it's important that you avoid over-the-counter medications and visit your eye surgeon. Second thing you can do from your side is that you can do some hot compresses like warm compresses. Take a cloth, dip it in hot water and put it over your eye. You can keep cleaning the discharge also regularly. You can also do cold compresses. Take ice and wrap it in clean cloth. That will also help in reducing swelling. So both warm compresses and cold compresses both help in this condition. So you can do that from your end. Now, important thing here is how do we prevent this? So to understand that, first understand how does it spread. Now suppose if I have conjunctivitis and if I touch my eye and then I touch a door handle and then you touch the door handle and then touch your eye, this is how you get it. There's a common misconception where people feel that if they look into the eyes of a person who has conjunctivitis, they will get conjunctivitis. So no, that's not true. Conjunctivitis mainly spreads by hands. Or say if I have used a towel to clean my eye and then you use the same towel, this is how you can get it. So how do you prevent this? Two things. First, maintain a very good hand hygiene. Your hands should be non-infected. That means all the virus and bacteria, your hands should be free of it. And second, don't touch your eye. Even if your hand is infected, if you don't touch your eye, you will not get conjunctivitis. Especially if you have it in one eye, protect your other eye. Don't touch your other eye or the infected eye at all. If you touch your infected eye, immediately wash your hands. So if you follow these two things, you will not get conjunctivitis. And other things that conjunctivitis patients should avoid to spread the infection is avoid swimming pools. Don't go in swimming pools in this season especially. And if you have conjunctivitis, you should avoid going to even public gatherings where there are more people. Also, if you have any slightest symptoms that I mentioned, avoid using a contact lens completely. Completely just remove the contact lens if you have any slightest symptom, the symptoms that I have described, because contact lens can sometimes cause very severe infection. So that has to be avoided. So follow these tips, stay safe, maintain hand hygiene, don't touch your eyes, and visit an eye doctor if you get any symptoms. Thank you.